Okay, so my name is Hugo-Ben Horn, and I've been playing rugby ever since I can remember. But yeah, throughout my high school career, and then after high school I went to the Sharks for 1 year. The first big injury I had was in school. It was in 2021. So we were training, and I was chasing after a ball, and I was running forward. Someone was coming to me, and he stepped, and I had to change direction quickly, but I was going forward full speed, and I had to stop and change direction. And when I stopped and I stepped on my left foot and I wanted to go that side, I just felt an enormous pain on the outside of my knee. After a few months, after the rugby was finished, I was talking to my mom and my dad, and I told them, but this pain isn't going anywhere. It's still there. I feel that I've been doing rehab and everything, but nothing's working. And then we went to go see our team doctor at the time. We had a team doctor with the school team. And I went to go see him, he examined me, and then he said, no, but he would like it if I went for MRI. And then I went for an MRI, and that showed us that I had a small tear in my meniscus the whole time.
I'm Himal Gajjar. I'm a radiologist at SCP Radiology. We see a vast range of acute injuries in various sports. It's such a big topic. Rugby is a very popular sport, and obviously a sport we all follow with passion. And we see a lot of acute rugby injuries. In terms of those groups of injuries, head injuries, such as a concussion, is a common injury. That is not often imaged, so a mild concussion is normally treated clinically, but if there is a severe concussion or atypical findings, then imaging is indicated, and that will usually be with a CT scan. That is the fastest and most accessible imaging modality, and we're looking for hemorrhage or bleeding on the brain. That can be in the brain tissue or around the brain. We'd make sure that there is no brain swelling. And also ensure that there are no skull fractures. In terms of the other acute injuries, next most frequent are lower limb injuries, followed by upper limb, and lastly chest, so sternal and rib injuries, and followed by abdominal wall or abdominal muscular injuries. So the imaging modality that is chosen usually depends on what the injury is and what the clinician suspects. So for example, in an acute bony injury, such as a shoulder dislocation or a clavicle fracture, an X-ray is an excellent tool and maybe the only imaging that is needed in that scenario. If there are more complex bony injuries, or a bony injury is suspected and not seen on an X-ray, then a CT scan is an excellent tool to look at the bones. But it is not a great tool to look at the soft tissues. And if a soft tissue injury is suspected, then either ultrasound or MRI is appropriate. Obviously, an ultrasound can only see what is accessible. So it is an excellent tool where something is superficial or accessible. But if the injury is deep, for example, within the knee joint, like an ACL tear, unfortunately, the bony structures obscure the sound beam. So there one would do an MRI. So one really tailors the imaging that is done dependent on the injury you suspect.
Through our team doctor, he got an appointment with another doctor in Stellenbosch to go for surgery. And yeah, so then I had my surgery, and I was on crutches for 6 weeks. Yeah, on crutches for 6 weeks, in a knee brace for 6 weeks, and then I started walking again. I think all in all, when the first time I started to run or jog again was three months.
Quite a common injury that we see is in the knee joint, and that is of what is described as a pivot shift injury. and that is associated with ACL tears. So the mechanism of the injury is, it's usually when there is a deceleration or rapid change in direction, which obviously occurs very commonly in rugby. And that normally happens when the foot is planted and the ankle moves outward relative to the knee, and the femur or thigh bone rotates internally. That cascade of movements heavily loads the ACL, and if that load is sufficient, then you can have an injury of the ACL. And that can be anything in the spectrum of a complete tear, so there's complete discontinuity of the ligament, to a partial tear, some fibers are torn and some remain intact, or a mild injury where there is a ligament sprain. The imaging of that usually starts with an X-ray to exclude a fracture. Sometimes we can see some bony changes that suggest that there is a ligament injury, although obviously X-rays don't show the ligaments directly, and we may see fluid in the joint or swelling or edema, which suggests that there is significant injury to the knee. So MR is the gold standard for imaging when one suspects an ACL or anterior cruciate ligament tear, and the ligament is like a rope, so it normally looks as a dark band of tissue that joins the femur and the tibia. And we'd look for discontinuity. That's the best sign that there is an injury of the ligament, that it's completely discontinuous, the fibers are not meeting, and there is a fluid-filled gap. Sometimes the ligament sags, so instead of being a tight rope, it actually flops down and is lax. That is also another good sign that the ligament is injured. And then we can look for other signs to say that this injury mechanism has occurred. So there are certain patterns of what we call bone bruising, where we see a bright signal or edema in the bone that tells us that a pivot shift injury has occurred. And then with a pivot shift injury and an ACL tear, there are a whole host of other associated injuries that we look for. The collateral ligaments, those are the ligaments on either side of the joint, those can be injured. And the menisci, both on the inner side, the medial and the lateral side, they can be torn. And then the articular cartilage, the cartilage that covers the bone, can also be injured. And then there are obviously associated soft tissue or muscular injuries. And MRI is an exquisite imaging tool that can assess all of these and give a grading and allow the referring physician, be that a doctor, orthopod, or a paraclinical healthcare professional, to make a diagnosis and plan the patient's treatment.
Well, it was quite simple. I went for my appointment, and it was a woman. She took me in. She told me to lay as still as possible. But yeah, seeing the machine was quite like an eye-opener almost. You don't know, and it was my first time as well. And laying there, you're hearing sounds and stuff, you're like, what's going on here? But now, all in all, it was quite simple. You can hear speaking. She spoke to me when I was lying there. So, no, it was quite simple, not stressful at all. Yeah, the most difficult part for me was just to lay still for half an hour. So that was actually the most difficult part.
Hi, my name is Prashna Naidoo. I am a diagnostic radiographer at SCP Radiology. When you arrive at the department, we will ask you to change into a gown if necessary, and also depending on the severity of your injury. We will then take you through and receive signed consent. Thereafter, you will go to the specific exam that the referring doctor requested for you, be it an X-ray or CT or an MRI. We will go through questions. Should it be relevant? If you are getting an MRI, it is important for us to know if you have any implants in your body that make it unsafe, or if you are getting a CT scan. We do not usually inject IV. However, if the need be, we need to know if there are any allergies that you have. Patient concerns when receiving any sort of imaging is one of the main things is radiation. However, we do adjust our protocol so that it gives you the least amount of radiation. One of the other major concerns is with MRI. A lot of patients are claustrophobic. However, we communicating with the patient also during the procedure, we can really ease them.
The clinical assessment of the injury is important and should occur as soon as possible after the injury has occurred. and your clinician, that may be an orthopod or sports physician or physiotherapist, will decide if imaging is required. If imaging is required, that should occur as soon as possible. Delaying imaging may result in an injury being aggravated, and it will also delay the treatment pathway. For example, if surgery is required, it's often best to intervene early to prevent muscle atrophy. So one wants to act fairly quickly and make a prompt diagnosis. The imaging forms part of the holistic care and management of the patient. So the clinician would have assessed the patient and decided they suspect these injuries. The imaging performed will allow a diagnosis of the imaging and a grading of the severity of the injury. And that's a critical component in deciding what the appropriate management is. I'll give you an example with a knee injury. And we've spoken about anterior cruciate ligament tears. One may have a complete tear of the ligament, and that unfortunately renders the knee unstable. And usually, or in most cases, that will require the ACL to be surgically repaired. Because if one doesn't do it and the knee is chronically unstable, that can predispose to accelerated damage within the joint. So it's the location of the injury and the grading. So if the ACL injury was not a complete tear but a sprain, that would heal on its own and wouldn't require surgery. Another knee injury is a medial collateral ligament, or MCL injury. In comparison with the ACL, these are usually treated conservatively. So even in a complete tear, often the clinician will decide not to surgically repair the ligament because it can scar down and become functional just with conservative management. So there, the imaging plays a critical role in revealing what structure is injured and how severe the injury is. And that allows the clinician to make a decision on what is the appropriate management. Is it surgery? Do I need to go in and fix the structure? Or can I be conservative, and then it's usually immobilization, ice, analgesia, and then progressive rehabilitation.
What you at least need to know about radiology in post-care is that after having any sort of imaging and the patient did require surgery or any sort of intervention, radiology is then still required afterwards to determine the healing process.
The need for patients to come back for follow-up imaging is highly dependent on the nature and severity of the injury they've sustained. For example, if it's a fracture, that would typically need follow-up x-rays at a regular interval to ensure that the healing process is occurring as expected and that there are no complications. In a muscle injury, it may be that imaging is only required at a once-off setting, and if the injury is not too severe, a diagnosis is made, a treatment plan has been formed, and the patient or player can continue on that pathway, and no follow-up imaging is required. If the clinician suspects a complication or it's a complex injury, then follow-up scans may be required.